good morning. It is a beautiful, beautiful Wednesday here, and it is time for tea or coffee or on High Impact TV. Yes, we have the full first GHD. No, we are the first full HD TV station in Nigeria. Awesome, as I always say. My name is Mudipe Jacobs, and I have with me two amazing ladies. First is and
Oluwaseun Olusegun.
good morning.
Good morning.
Good morning, ladies.
How are you?
Show, it's good to have you again.
Thank you for having me again.
Okay, so today we'll be talking about self-medication. And you know, anytime I hear self-medication, what comes to my mind is, our Nigerian mothers.
I know, right?
Our mothers.
I
You know, because any simple thing, any ailment, whatever, sickness, you know, that is wrong, or the easiest one, you have a headache, and then, oh yes, okay, use this drug. Use it. It's self-medication. No.
Even when you
We
try
know
to
these
explain to them,
things.
you hear, thank God, when we send you people to school, you people that used to come back over and tell us first aid treatment.
I'm telling you.
And I feel like
It's
as
part
a
of the first
Nigerian
aid
mother,
treatment.
it's a part of the training that you get as a Nigerian mother to
Yes.
always have this. There's always in every Nigerian home this box of drugs where you have some pain relief for headache, you have for tummy, you have for all
Even
those
the
drugs.
traditional
We have a
method
first aid
also.
box at home.
Yeah, everything.
Even traditional method, the concussion and everything.
That
It
one,
has
to
it.
the drinks, the mixtures and everything. So it's just like everywhere you
I
go.
can even share my experience. My mom,
Okay.
oh no, every Saturday morning, the next thing you hear is, Monday you eat biscuit, Tuesday, it's as if she is following what I'm eating. Monday you eat biscuit, Tuesday you take sweets, Wednesday you take gum. She'll start calculating for you. Friday you take chocolate. Now Saturday, what do you take? You take this.
To cleanse your system.
Honestly, you don't want to see the race in the house, because I start running about it. I can't take this. Do you understand? Now, then I sit her down and say, okay, what is the benefit of me taking
The concussion.
the concussion? And she says, it will cure it. She will not even tell you that it will make you feel better. It will cure it. It will remove it.
That reminds me. See, the first time it was on a Saturday, just like she said. I think
Okay.
there are a lot of rituals associated with Saturdays. So there was one day like that, and my mom decided to give us all aloe vera. My God, that day. Now, I don't mean any form of refined aloe vera now. The raw one, the
raw
one
one,
you scrape from the plants. Jesus! I puked because it was so bitter. I mean, I used to see her drink it and I'm like, oh yeah, there is nothing wrong with it. It's just some colorless juice. And then when she scraped it for us, my God, I puked everything within my system. And then she was like, oh yeah, you know, everything sugary you've been taking between Monday, Tuesday, Wednesday. On Saturday, balance it. There's a way that the bitter thing balances the sweet
You know, I
things.
thought
And
it
I'm
was
like,
just my
God.
mom that had the timetable for what you eat. during
Oh,
the week.
no way. All Nigerian mothers do.
I think yours is still better because, you know, concussion, aloe vera. My mother, I hope she's not watching. But really, sometimes I'm like, really? You know, okay, there's some times when maybe I have a headache or tummy ache, and then she brings some kind of drugs. Now, this is not concussion. Concussion, you can say, okay, let me try. Drugs. And, you know, for me, I know that, okay, this particular drug is not what I'm supposed to use. And she goes, I stayed with a nurse when I was young. I know that this is right for you, and it becomes an argument.
No, one popular one that I know my mom would always tell me, did you give birth to me or I gave birth to you?
Don't go there.
Who
Now, when
came
they
to
start
this?
that, no. You can
But
never win that
really,
argument.
really, self-medication is not good. It really is not good. Although we do it almost all the time. I see everyone actually does it. Am I right?
To a large extent,
I am
actually.
a victim, actually.
You know, I think everyone actually does it because, you know, you have a headache, you don't want to go to the hospital. Because you go to the hospital and then you have bills to pay. You understand? You have bills to pay, and probably at that time you don't have enough money with you, and all you can do is just go to a nearby store, you know, and get a drug to use to make you feel better. So in as much as, you know, maybe there are excuses for self-medication, but to me, I feel it's not ideal.
Because I was
What do
going
you
to say,
think?
even if self-medication is not good. Now, are you saying that every time you have a symptom of headache or fever or something is wrong with you, you go to the hospital. Okay, I'm stooling. I need to get to the hospital. Imagine a situation whereby probably today, because you never can tell how your body system will react to things.
True.
So imagine maybe today you ate something you were not supposed to eat and you're stooling. Okay, let me run to the hospital today. The following day, headache comes. Let me go to the hospital. The next day, something else, cold, fever. You go to the hospital. Even the doctor will even say,
You know, that's why I say that there are excuses for it.
That would definitely be a whole lot of topic, a different one. Now, I feel that is where the primary healthcare comes in, because we're supposed to have primary healthcare is actually the foundation of healthcare system in any country, because it's supposed to be that place where you can always run to for the small thing, and then when it gets too serious, you get referred to the serious places. So not necessarily hospital, but then I understand the point that you get
It's not every single thing you want to go to the hospital for.
Yeah, yeah. And sometimes, you feel like, oh, yeah, it's just a headache. It's just body pains. Besides, I know what to do. I know that. And then you just go to the nearby pharmacy and then we'll self-medicate.
You know, in the process of learning self-medication, and I was talking with Bolade, a colleague.
Okay.
So she mentioned some self-medication on food. And I'm like, okay.
Yes. What is that? Yeah. Food.
Okay. And she goes like, when you are going through certain situations, because normally drugs and medications are meant to help you suppress pain or whatever you're going through. And she goes like, if you're an emotional eater.
Oh, yeah.
Yes, then you tend to
So
eat a lot. When you're depressed, you run to food to eat. When you are in a situation where you cannot handle your emotions or you cannot handle yourself, you run to eat. That is also self-medication.
That's psychological.
Okay. Anyway, you know that it's also quite funny, the way, I really don't know if a chemist is the same thing or the same person as a pharmacist.
You know,
because
I
we
wouldn't
use it
even lie.
interchangeably these days, and then I don't really know.
I wouldn't lie. When I'm giving prescriptions and I'm supposed to go to a drugstore to get medication, the first thing you hear is, Mom, please, I want to get to the chemist.
And they have this white painting, there's almost like you have one in every street or
yes. And why is that building always painted white? Like you mentioned, it's always white.
And then you have the shelf and then everything. And then the funny thing is they get to sell more things also than drugs.
Yes.
They
don't
there's
only
a part
sell
of drugs, then
yes.
you see provisions. Like, okay.
It's like an unspoken rule.
They're turned into a store, not just a drugstore now.
Yeah, a provision store.
There's one Yoruba word that is coming to my head, but I'm not going to say it. Okay, so on the show today, we have a guest. He is a pharmacist. And thankfully, you'll be able to tell us the difference between a pharmacist and a chemist.
I really can't wait for the guest to actually come and clear that air, because I am also guilty of saying when I want to get
guilty as charged.
Okay, so before we bring our guests on the show, let us go on a break. And when we come back,
I like that vibe. Let us go on.
And when we're back, the conversation, will definitely continue. Stay glued.
Have a thrilling and bonding experience at High Impact Planet Amusement Park and Resort. Enjoy an amazing retreat in our extremely secured environment with our breathtaking rides. Set goals for the upcoming year in our convenient multi-purpose halls. Bond between team members while giving your staff a desirable treat. High Impact Planet. Fun just got real.
When you think about it, there's a lot to celebrate in our lives. From the smallest milestones to our biggest moments, we'll pamper you at High Impact Planet. Whatever the occasion, let's celebrate you at High Impact Planet, where fun just got real.
welcome back from that short break. As you know, this is still High Impact Television, and this is still your favorite, even if you want to deny it, your favorite breakfast show here on your first full HD television in Nigeria. And we've been talking about self-medication. So now we're going to get into the topic fully. And here with us, we have a pharmacist. His name is Ifeloluwa Adefolaju.
Good
Hi.
morning.
Good morning.
Welcome to the show.
Thank
Yes.
you.
And thank you for coming here. So we're going right into the topic, self-medication. But first, we know that there's really no difference between drugs and a pharmacist. Yeah? So who is a pharmacist? In this 21st century, who is a pharmacist? What is the role of a pharmacist?
Okay, thank you. A pharmacist is a member of the healthcare professional team that specializes in drugs, medicines, production, and ensures the safe and efficacious use of those drugs. So in our time now, pharmacists and drugs, like, together.
Okay. All right. So now we're talking about the difference between a pharmacist and a chemist, because these days we use it interchangeably. So is there actually a difference between the role of a pharmacist and the role of a chemist?
I would say, erstwhile, we use the word chemists. As during in UK when we were colonized and the like, so pharmacists were referred to as chemists, were referred to as druggists.
Okay.
Yes. So, but with new studies, new, how would I put it, courses coming up, we tend to separate the chemists from the pharmacists, but people still refer to us as chemists. Some druggists, well, ideally the word is pharmacist.
Pharmacists, but they're actually the same thing. You do the same thing.
Yeah.
So I'm not
Before,
wrong.
we used to do the same. Yeah, but now
by calling
it's
them
pharmacists.
Pharmacists.
Yeah,
Yeah.
because
So we are
chemists
starting
now,
with
people that study chemistry would want
Okay.
you to refer to them
As
as.
chemist. Okay,
chemi-
so professionally is pharmacist.
Yes, ma'am.
Okay, correct. All right, now, why do people actually indulge in self-medication?
There are a couple of reasons. Number one, people do not like the long queues at the hospital. Yes, trust me. Because a couple of them, once they come and you tell them, "Ma, why didn't you go to run a test? Why didn't you go see the doctor?" They will tell you they can't go and waste the whole day sitting down, waiting. So some people don't like the long queues. Other people want fast relief.
Okay.
You don't want that situation whereby you are down, you are not being able to walk. So some people just go to the pharmacy and want to self-medicate. So some people just get drugs, which is bad, by the side of the road. That's another thing that it's uncalled for. So long queues, people want to feel fine. Then there's information everywhere now.
Exactly.
Because I get a couple of patients or clients that come in and they ask specifically for what they want. And I'm like, "Ma, where did you get this from?" And I'm like, Google.
Really?
Yeah, that's like that's what they say now. Like Google that. I had an instance whereby a patient walked in and asked for a specific drug, ceftriaxone. That's the generic name of the drug, ceftriaxone. And I was asking him, "What do you want to use it for, sir?" And he got all angry. Like, "Why are you asking me? Give me the drug. If you don't," I'm like, "It is my duty
Yeah,
to know.
to know.
Because I'm the custodian of the drugs. I should know what you want to use it for." And he got so angry,
And it
walked
wasn't
out.
like it wasn't prescribed by a
It
doctor.
wasn't. In fact, it came with the phone. So I was even
Wow.
thinking the doctor
Screen grab.
like e-prescription or something. The guy just showed it to me. I'm like, that you cannot use this. And what he even wanted to use it for, the drug was not in line.
In line.
At all.
You can imagine.
So there's knowledge everywhere now. People just go online, check these things. Then sympathy also, to an extent. Like your sister is down, your mother is down, and maybe
We just want to help to relieve the pain.
or this has happened to you before. So you feel that, I remember when it happened to me, this was what I used. Let me get it so that you can use it. So those are and on, like there are different reasons why people just self-medicate. And easy access to drugs also. There are no strict rules or strict laws that ban people or watch out the way people purchase drugs. You see people, even once it's 9 p.m., 10 p.m., you see some people just top some trays by the side of the road. and they are
Yeah,
selling
common
drugs.
sites.
Yeah,
True.
common sites. Yeah, and you see them, and people patronize them. So these things, they aid self-medication.
Okay, let me come in there.
Okay.
You talked about information, people knowing a lot now. I believe that there are actually adverts you see
I was
that
going to
they
ask
would
that.
yes, they
Yes.
will tell you what this drug is about. They will tell you the symptoms you likely see and why you should use the drug.
And even how to take
How
it.
to take the drugs. So now, when people see that, they go get the drugs. Like, okay, now this is what is wrong with me. I've seen the advert that this
Advert,
drug would work for me. Why do I still have to go see
the
the doctor
hospital.
or go to the
Yeah.
hospital? So, do you think that is aiding self-medication?
Well, you have the right to know what a drug is about.
It's about.
That's why I tell many of my clients or patients that you have the right. If somebody gives you a drug and you don't know what it's being used for, you need to question. So to an extent, I would not fault that, of which we classify drugs based on OTC drugs and prescription drugs. So
OTC
being over the counter.
Okay.
So there are some drugs that can be purchased over the counter. So in that kind of situation, yes, the patients can or the clients can. But when you're standing towards prescription sites or some drugs whereby you would not want a misuse of those drugs, like antibiotics, so to say now, because that's another drug that people really use, like self-medication at its peak. Yeah, people, in fact, you see cases where people use antibiotics to prevent pregnancy, and I'm like,
What?
how is that working?
Really?
Like,
How?
yeah, because throughout my years of study, I've not seen a situation whereby antibiotics prevent, but
I know antibiotics works for boil. Am I right?
yeah, well, antibiotics is
An
a broad
excellent-
like
It's
category.
broad, yes,
Yeah.
Oh,
because
great.
you mentioned, but I was going to mention infections because
Yeah.
I know that I've been told that antibiotics could help for infections.
Infection.
It now depends on what kind of infection, and also depends on what kind of antibiotic you are using for that infection. So these things, you cannot just tell me that, okay, I'm coming down with so and so symptom, and this is the drug for it. There are lots of disease conditions can present with the same symptoms. You get, that's why many of these adverts will tell you that in 3 days or in 2 days, if you are
See
not
your
better,
doctor.
go see your doctor, and things like that. So fine, there are OTC drugs, people can get them, but at the same time, you still need to speak to a healthcare
doctor.
professional.
Professional.
And that-
Sorry, go ahead.
That brings me to a question. Do you think self-medication actually encourages drug abuse and misuse too?
Yeah, it does, because if you don't have the proper knowledge about the drug, you can use it anyhow, which will amount to a misuse. And some drugs present with some side effects that give that high feeling. You get, so that could lead to drug abuse. So that's like the difference between the abuse and misuse. People abuse drugs because they want a particular feeling out of it. Misuse in the sense that, okay, I give you a drug, maybe you get a sleeping pill, or you come with a prescription for a sleeping pill, and then the instruction is use 30 minutes before bedtime, or use 1 hour before bedtime, one tablet. And then you use it maybe 9 p.m. and 11, you're still up, your eyes are still open. People use another one.
So that, yeah.
That is misuse. Because the instruction was use one before bed. So even if you don't get to sleep, even if you are not meant to use another one. But because they can purchase these drugs anyhow and from anywhere, because I've had instances whereby I would stand my ground and tell the patient or client that without a prescription, I would not give you this drug. And then they storm out saying, it's not only your pharmacy that is, I would go somewhere else, or I even go by the side of the road to get it. So even filling of old prescriptions too, self-medications.
Yeah. I was about to say, so for example, the doctor originally gave you a cough syrup,
Okay.
and then according to the dosage, you're supposed to use maybe 15 ml 3 times a day, and then you exhaust that bottle, and then the cough is still not gone. Do you have the right? Do you think you can still get another bottle, or you should go back to the doctor and say, okay, doctor, it's not gone, should I continue? Or you could just go into the pharmacy and get one for yourself.
Ideally, you are supposed to report back
To the
to
doctor.
the healthcare professional that gave you that drug. But people, because if you use, let's say, the cough syrup, like you said, so if you're using it and you're not still better after like 5 days, it's a different thing now, because most of these cough syrups comes in like 100 ml bottles and 150 ml bottles. So if you are using 15 mils 3 times a day, it would not last you for like 5 days.
5 days.
You get, if you go back like, oh, I'm supposed to use this for 5 days, I've run out of it, let me get more. Within that 5 days, that's a different thing. But if the 5 days have expired and you're still not better, the ideal thing is to report back. Because a secondary infection might have come up or something else could have been causing that cough to be persistent. So a different thing. So you just go back, report, and then they'll proceed from there.
Okay, so do you feel that self-medication is acceptable to an extent? Because, you know, we're talking about the fact that it's not every sickness or ailment that you want to go to the hospital for, like a headache, stomach ache or something. So do you think self-medicating, like going to a pharmacist to get a drug, is that self-medication?
Like you said, like we said earlier, the OTC drugs.
Okay.
So that's why I would always recommend, if you are going to the pharmacy, ask for the pharmacist.
Okay.
So even if you are going for the drug or you feel it's something minor or something that I don't need to go to the hospital for, by the time you speak to the pharmacist, you get the ideal information about that drug. And then some of them would even want to monitor you and say, okay, madam, if you are not better in 2 days,
Go see a doctor.
yeah, go see a doctor or let me know or come back. So things like that, because fine, stress, lots of things can bring up headaches,
Yes.
different things, even allergies and the likes. So yeah, OTC medications are available for those kind of situations. But in a case whereby you are not getting a relief, you still have to speak to a healthcare professional.
Maybe you actually didn't get what I was trying, the point I was trying to make. I'm saying that, can we say there is an excuse for self-medication? Let me put it that way. Or it's totally bad, we shouldn't
I
do it?
would not say it's totally bad.
Okay.
Because like I said, there's a reason why they are over-the-counter drugs.
Okay.
There's a reason why you can go and purchase them over the counter without a prescription. Because when you go to see the doctor, you get a prescription for prescription meds. Or even some of the OTC meds, the doctor would write a prescription for it. But there are some that are over the counter that you can get. So yes, you have a headache now. I don't expect you to just go straight, except the headache has been persistent for a while. So in those kind of situations, yeah, there's a level of an excuse.
Okay. But in situations where, because you were saying something that you can easily go and see a pharmacist. So if I have a headache and I go see a pharmacist and say, okay, these are the symptoms, this is what I'm seeing, what should I take? That is not self-medication.
No, that is because you are spoken or you're consulted a healthcare professional.
All right, now talking about indulging in self-medications, you know, a lot of people do not know the side effects of taking, like you likely mentioned earlier in conversation, that antibiotics, people just take antibiotics for avoiding pregnancy. Yes, which
Insane.
no, a lot of people do not have knowledge or idea of what they are doing. Like now, I could just, probably a doctor referred or prescribed that drug to me, and then I come to you, Sheung, and tell you that it worked for me, I think it would work for you too. And now, so what are the side effects or dangers to self-medication when you do not consult appropriately?
The number one side effect or dangers that bothers me, and I know a couple of healthcare professionals, is drug resistance. That is like our number one battle now. Because take for instance, you come, you get the Ampiclox, that's the generic ampicillin, cloxacillin. You get that one and you say, oh, I want to use it to prevent pregnancy. You don't have an infection. Antibiotics work for infections. They work to curb microorganisms, the growth of those microorganisms. So you don't have an infection and you are using an antibiotic to prevent pregnancy. The organisms in you develop resistance over time. Over time. And there was a particular month whereby I had a patient or a client that was coming every week to get the antibiotic. Every week.
What for?
Why?
Because she was having unprotected sex and wanted to keep preventing pregnancy. And I had to sit her down because I even thought she was treating something till I just called her, what are you using it for, many of them would not want to tell you. So you would have to press forward that, let me know now. I could add something else or give you, you get,
from
you just
that
You know,
you get. So
open up.
then she opened up and I was like, ma, this is totally wrong.
Wow.
You're not supposed. So apart from drug resistance is like a major problem now because you find out that many antibiotics really don't work as they used to. You're getting a resistance. You have to be dealing, changing doses. So that at least in some cases, healthcare professionals might increase. The doctor might decide to increase the dose so that it's just like I come every day to you and I give you a punch. I give you a punch every day, just one punch. You get used to it. So same thing with these organisms, and we always have microorganisms on us as we speak now. The microorganisms on our skin, everywhere. Yeah, everywhere. You can't see them.
I was trying to check for you.
Flora fauna.
Yes. So they're everywhere. So the drug resistance is number one. Number two, there are some side effects that we call idiosyncratic side effects.
Okay.
In this kind of situation now, fine, this drug or the drug in question might be safe or is considered safe. Mind you, all drugs have side effects. Even your paracetamol that you think is safe.
In caps.
All drugs.
All drugs
All
have side
drugs
effects.
have side effects. It just
Very
depends on the dosing, how you use it, in what conditions you use it, what you use it with. So things like, because there are things referred to as drug-drug interactions,
Wait,
drug-food
drugs,
interactions.
Are you saying vitamin C is also part of it?
I don't know, I
No,
can
I
qualify
think
for something
that.
like
Let me comment in there. You know, on some of this vitamin C tablets or pack, you see, there's a particular dosage they're supposed to use, and some people actually use more than it. But I don't know if
The
they have
vitamin
I'm a
C?
victim because
Yes, vitamin C,
especially the
yes.
orange one. It's
Guilty.
sweet. And you know, I take it
I lick it
like
endlessly.
5.
So
I
you're
take
guilty.
it
How
in.
many times? You know, vitamin C has its own dosage also.
Yes.
The
So,
orange one.
Every vitamin C is
Every
vitamin
the
C.
white
It's actually like
Whether
sweet
white,
for me. You
amber
know?
colored, everything. Vitamin C is vitamin C.
Yes.
Ascorbic acid.
I think it's 10
I
per
should come on
day.
my face
Yeah,
right now.
yeah, 100
I know.
milligrams. Some people can do 1,000 milligram, depending. You can use like 1,000 milligram daily, or some people do like 1,500 milligram daily.
But
So
what
at
is
least-
the side effects of the overdosing on vitamin C?
Vitamin C.
You would not want much of vitamin C in your system. Fine, it's good. It's an antioxidant. It helps lots of things. But in some cases, vitamin C is relatively safe to an extent. We're lucky in that sense because it is water soluble. So your body takes what it needs and most times excretes what it does in it.
Because at the point you mentioned all drugs have side effects.
Okay, like,
Vitamin C too, because I take that almost every day. I mean,
Yeah, no,
Wow.
it's good. If you're taking every day and once you are not exceeding,
Exceeding the dosage.
or maybe you should just dump it for the natural sauce. That shouldn't have a side effect now. Like, you know, I feel like if you're taking it from the natural source, which is fruit, you probably will not take as much as you have in that 100.
you know, I was going to say natural sauce, just stay under the sun.
so that's
That's
vitamin
vitamin
D.
D.
Okay, that's
vitamin D.
the
Mhm. So yes, if you're taking fruits and other sources, you will not get as much
As you get in a drug.
in the
Yes.
Okay.
So at least that would give you like a daily maintenance dose or a weekly maintenance dose depending on how well you're using it. So back to the idiosyncratic things. So there are some people that when they use a seemingly harmless drug, they react to it. Because when you're talking about genomics, pharmacogenomics, you're going down to the gene levels. There are some genes that I might have that can help me metabolize that drug that you don't have. Because you wouldn't know. It's not like you've gone for a test or you found out that, okay, you are lacking this particular enzyme that is responsible for the metabolism of this drug. So you use it and then poof, everything goes AWire. And then you come back, they sold you fake drugs, they sold you substandard drugs. Meanwhile, nobody even knew when you got it. A friend probably recommended it to you. You used it and then you come down with such side effects. There are also issues of misdiagnosis.
Okay. What's that?
Because you are using an antibiotic, for instance. I'll keep mentioning antibiotics because they're like really.
Yes, I
Yeah.
think that's the common one.
Yes.
Yes.
So you use it, you have an infection. Let's give an instance now. And then you went to use an antibiotic. Fine. There are some antibiotics referred to as broad spectrum, meaning they take care of a couple of microorganisms, a large number of microorganisms. It doesn't mean it is specific for that microorganism. You get? So you have an infection, you come down with something, and then you just go and take, let's take for instance now ciprofloxacin. It's also a common drug that people get over the counter anyhow. So you take ciprofloxacin, it's...
Is it a type of antibiotic?
Yes, it is.
Okay.
It's a fluoroquinolone. So you use it, it helps to reduce... Sorry. It helps to reduce the level of the microorganism in your system. Or let's say it numbs it. Let's say it gives it that anesthetic effect, just puts it to sleep.
Okay.
So you are not getting better. And then you go to the hospital, you run a test. There's a particular level that these organisms should be, that they will be detected by the certain tests that would run. But you have used the antibiotic, you've put the organism to sleep, it might not show up in the test that, oh, this guy is suffering from, let's say, staphylococcus, for instance. And then they don't find anything. So the doctor will tell you, oh, go back, there's nothing wrong, just
When
sleep
they wake
properly.
up,
And they keep
trouble.
getting worse over time because they have used those drugs, the antibiotics, has put the organisms to sleep. So you have that danger of misdiagnosis. You also have a danger of whereby the drug is working. Maybe you're using one drug now. That will bring me to drug-drug interactions.
Okay.
Let's take, for instance, somebody is on hypoglycemic agents. That's drug to reduce blood sugar level.
Okay.
So, and the person is also maybe during a medical outreach, they found out that the blood pressure is quite high. And then, oh, you get home, you tell your friend, my blood pressure was high today. This one, and I'm like, oh, I also have high blood pressure issues, and I use this particular drug.
give your own drug.
Let's take, for instance, beta blockers. And then you give the drug,
The person.
and the person is using it. Mind you, the person is on oral hypoglycemic agents. Hypoglycemic agents reduce the blood sugar. There's a particular level each should not get to. That would be. So part of the effects of blood sugar, low blood sugar level, is your heart beating faster because your heart is trying to compensate for the glucose need in the body. So it's beating faster to try and meet up with your metabolic demands and the likes. So, but your friend gave you his own beta blockers and you're using.
You're hypertensive.
Beta blockers mask that effect. I hope you're not lost.
No.
Trying not to be.
You know the heart is trying to compensate. You've used, let's say you've used your oral hypoglycemics this morning.
Yes.
Your blood sugar should not pass a particular level. It's going low. Your body is trying to signal to you that this thing is low. This thing is low. So the heart is supposed to be beating faster. But the beta blockers that you've used for the hypertension now would reduce or slow down your heart rate.
So you won't know.
So you wouldn't know.
Wow.
So you just see the person just knocks out or slumps or
Slums.
goes unconscious.
You have you just hear someone slumped and you don't know exactly what happened.
There
Or what
are lots of that going around now. You just because people just come and they're like, my friend died last week. He just nothing was happening. It was fine.
I know, like I still had a conversation with him, and then the following day,
Yeah, one happened around my office, and they were saying it was spiritual attack. I said, madam, don't let's go there first. Let's go because I see the things you people do around. I try to warn you. I tell you, you are my immediate environment. I try as much as possible. Please don't mix so and so together. You see people mixing drugs and putting them inside gin to drink.
Oh, that's one.
Yeah.
Oh,
Really?
It's you need to know what is going on out there.
different concussions.
Different people mix up a couple of
And
things.
thank God for tea or coffee, a good
Yes.
platform to actually inform and educate
Yes,
people.
yes, because that's part of what we need to be doing, health awareness.
Yeah.
People need to know these things because they just mix up a couple of things. You just use drugs. Apart from drug interactions, you also have drug-food interactions.
I mentioned that earlier on.
Yes, yes. Maybe that should lead us to our next question.
Okay, let me cut you short before you answer,
Okay.
answer that or ask that rather. Because I have this one. There are a lot of people, okay, it's a two-parter. First, how was it supposed to be the right procedure for taking drugs? Because I know there were a lot of people that put their drugs inside bowls of food, like eba.
Yeah.
Put it inside because they feel like it's
to
bitter.
taste it.
Now, first,
Yeah.
does that reduce the potency or the efficacy of the drug?
The drug.
And secondly, what best fluid or liquid should you use in taking your drug? Because I know when you mentioned the gin, there were a lot of people that they'd be like, I
Soft
can't
drink.
say drug with water. It's not good.
There was even one
Yeah.
time that
So soft
I had
drinks.
to tell my mom that the doctor didn't say it, but the drug was so bitter, so I told my mom.
Oh,
that
so she's a culprit.
Doctor said that I should use hot 7-Up
No,
to take the
soft drink.
the soft drink to take the drug. I'm like,
Yeah.
okay. And my mom said, okay, no, you take now
child.
because I mentioned doctor. You know.
So yeah, back to the question. A lot of people do that actually. They practice. I know people that they can take drugs with water, carbonated drink, fizzy drinks. You know, all those sweet alcohol. So, is there an adverse effect?
Yes. Especially with alcohol.
Okay.
Alcohol is, let me go into the whole metabolism thing now, liver enzymes, this and this. But there are some drugs that the enzymes responsible for metabolizing those drugs are also the enzymes responsible for metabolizing alcohol. We refer to alcohol as a drug because it has depressant effects on the central nervous system. So we refer to alcohol as a drug. So that brings us back to the drug-drug interaction. So now alcohol is a drug, then you're using a drug to take it. There's this very common drug, metronidazole, that people use a lot for purging and the likes. People tend to use it with alcohol, and it like triples the hangover effect. It's really bad. You call it a disulfiram effect. It's really bad. So imagine now using antidepressants or drugs that work on the CNS, like drugs like what's it called, diazepam. You use it and then you use alcohol alongside, which is also a CNS depressant. You increase that CNS depressing effect. So fine, the doctor or the pharmacist is in good mind, told you please take with water. And is trying to sleep at night, and then you come rushing emergency and, well, what's happening? What did you do? Then you find out you used with alcohol. There are also cases whereby some drugs we prefer or it works better on an empty stomach.
Oh,
really?
Yeah.
I used to think
Without
drugs
water?
are best with
No,
food.
with water. You take it with water. But
Okay.
empty stomach,
But
no
without
food. Because people just have this idea that
You have to
take
eat.
drugs with food. You have to eat
I thought that
before you
drugs.
take it. There are some drugs that work better on an empty stomach.
Wow, this is a new one.
Yeah.
I just
And
learned
there are
that.
some drugs that, because they cause gastrointestinal side effects, we prefer you use them after food. So that there's something in your tummy. So the idea of putting the drug in a bar or something, you, unless otherwise stated, you, to an extent, if you're not even affecting the work or what the drug's supposed to do, you are going to prolong the timing of which it's up, because your body would have to first decoat the EBA jacket that you put on it. So it first have to go through that before it now gets to the drug, before it now disintegrates. So then you're wondering, and that's why a lot of people come and say, oh, this paracetamol is fake paracetamol. This one is, how did you use it? Because when you come to me and you tell me, I used this drug, it didn't work, the first question I was asking is, how did you use the drug?
So that means there is a way to use a drug.
Yeah,
that
that's
will
why
make it
you
work.
must always, that's why the pharmacist now must be your friend. So you get drugs, you get a prescription from a doctor. Once you get to the pharmacy, ask, please, is the pharmacist around? I want to speak to the pharmacist, because there are lots of information about drugs that we cannot exhaust. In fact, we always have to update our knowledge every now and then to make sure that we're meeting the needs of the people. Because you come now, oh, how did you use it? How can I use this? Use like this. Don't take with this drug. Don't take with grapefruit. Grapefruit, like it's an enzyme inhibitor, so it stops or slows down the metabolism of some drugs. Even your common drug like cimetidine that people use for ulcer, there are some particular drugs that you don't use alongside the cimetidine, because the enzymes responsible for metabolizing that, it will bind to those enzymes and not allow those other drugs to be metabolized. Drugs like phenytoin, drugs like even sildenafil that men use for erectile dysfunction, like to enhance sexual powers. So if those drugs stay longer in your body, they will tend to cause toxicity. Because they are staying longer than usual. They are not being metabolized, so you have more of that drug circulating in your system. Which, according to the manufacturers, according to we pharmacists, we just say, okay, in 2 hours this drug should have been cleared out of your system. But because you used it with this particular drug or with this particular fruit without getting the necessary information, the drug can stay like 4 hours, 5 hours, 6 hours, and then doing damage in the system. Of which all these damages you wouldn't know, because over time, these things are over time. It takes time. One day, you just get to the hospital and they'll tell you, oh, even for something different, you probably went for malaria checkup or typhoid fever or something, and then they'll tell you, oh, madam, that is another issue why people don't like going to the hospital.
Because they will give them bad news.
Exactly.
And still talking about information, there should be a need. I think people should get the awareness more that you should always read the information on the labels. There's a reason, those stuff that come with the drug.
Yes.
For them to read the drug, right?
Yes.
The drug.
But sometimes they don't even those papers, leaflets that are inside the packs. They don't give like full information. Sometimes you can't even interpret what is there.
That's what I wanted to say.
You can't even interpret
You
it.
might not be able to
like
interpret
so many
it.
terms you see that could get confusing, like staphylococcus.
Shelly, if you do not understand the technical terms or the medical jargon,
right?
Like he has been calling
There are many of them like that. So you have people like, there was this instance whereby a patient came with a prescription for an eye drop or something. And I gave him the eye drop. I told him, did you see the doctor? He said, yes. He explained everything. The doctor, I said, no problem. This is the eye drop. This is how you use it. Then he sat down in the office, opened the drug, brought out the leaflet, and started reading through.
True.
And I sat down and I was smiling. I was smiling at him because I knew he was going to get confused. Because even Google that people run to, people come and they start coming, this is probably a symptom of cancer. I'm like, just calm down. Just calm down first, because if you don't know how to process those informations, you would blow the thing out of proportion.
Just freak out.
Yes.
Because there are actually ailments that have similar symptoms.
Yes.
Exactly.
Yes.
There's even something we refer to as hypochondriasis. That's a diseased mind, is a diseased body. So you read the leaflet, you don't understand. This particular guy in question did not take that eye drop away, because he read through and he was like, he was seeing conjunctivitis, allergic conjunctivitis. I know, like, even in the leaflet, they wrote it there, please speak to your pharmacist. Let him explain better. For further consultation, he refused to take the drug. He said,
and he didn't let you explain exactly what was there.
He didn't. So I could not force him. I tried my best. Oh, calm down, I would explain. He said, no, he doesn't. What he complains to the doctor is not all this that is written. So fine, in as much as we tell you, okay, we want people to be aware. Like, I don't support the idea of you going to the hospital or a pharmacy and they just count the drugs in the envelope, and you don't even know what you are taking. Yes, you should know what you're taking. You have the right to know what you're taking. Fine, some people might not want you to know because they don't want you to go and get more of that drug, which still leads us back to self-medication. They won't want you to self-medicate to go and get more of that drug, because even filling of old prescriptions is also self-medication. So, but you have the right as the patient, as the client, to know what you are taking. That's why the pharmacist is there. He knows, so to say, everything about the drug, in quote, to an extent, if not 100%. So speak to the pharmacist, gain knowledge, then it will all be fine.
You know, so when you were talking, something came to my mind. Is something that my mom actually experienced. Now, I feel that pharmacists should actually, we should have pharmacists in the hospital to explain like you said, you can't just put drugs inside, you know, a paper or something, envelope, and say, use this twice a day, 3 times a day, and you don't know what you're using. Because, okay, the case of my mom now, I think she was supposed to be treated for, I think it was malaria and typhoid, and then she was being given injection and drugs for something different entirely. And if not cause, I don't know how we got to find out, she wasn't getting any better, you know, so we had to go back. And then the doctor was like, this is not what you were supposed to use. Maybe the person that was supposed to administer the drugs to her, you know, read something different, you know, the way our doctors write. Maybe she was seeing something different, you know. So do you feel that pharmacists, we should have pharmacists in the hospital too?
Pharmacists are actually in the hospital.
Okay, so the person that administered this particular drug.
If you are going to be given an injection, the pharmacist wouldn't be the one to give you that. It's going to be probably the nurses.
I'm referring to the drug now
or
that she was
doctors
giving,
themselves.
because for something else, not even malaria and typhoid.
In some hospitals, you don't get pharmacists there.
Okay.
Which, in that sense, fine. We say, okay, even if there's no pharmacy department or there's no pharmacist there, the hospital can have drugs for immediate needs. Like somebody is being rushed in now for an emergency, yes, there should be an immediate need. You get those kind of drugs. But when it has to be, okay, something you take for a long time, if there's no pharmacist in the hospital, if there's no pharmacy department, you can go into a community pharmacist, get the drug, speak to the pharmacist. Because we have instances whereby people even take wrong drugs. And people always have this idea that because you probably worked in the hospital or the pharmacy, you know drugs.
I was actually going to, I was chilling to ask that question. First, 2 questions as always.
Okay.
Who should have a drugstore? Because I see lots of healthcare professionals or people of the medical team having drugstores outside, because I wouldn't exactly call it a pharmacy now. You have nurses, you have doctors, you have midlife scientists. It's almost like once you work in the hospital or a clinic, you have that license to have a drugstore. And then, you know the sad part? Some of them are actually not the ones in charge of it. Some of them just put uneducated people in that field. So who should have a drugstore?
That's part of what we are trying to do, because the Pharmacists Council of Nigeria goes around inspections. As part of the inspections they carry out so that self-medication can be curtailed. Fine, pharmacists are the ones in charge of drugstores, in quotes, the pharmacy. But we also have patent medicine dealers.
Okay.
In such places, you are supposed to just have strictly over-the-counter medications.
Okay.
You get, because we how would I put it, we have a shortfall of pharmacists in the country. We don't have that much. In fact, I would say pharmacists are like the least number of people in the healthcare team.
Really?
Yeah.
Really?
So we have
That's surprising to me.
like a low number of pharmacists, yes, in the country. So in that kind of situation now, you can't say, okay, fine, a pharmacy must be here. People, because you want to meet the healthcare demands of people, that's when the old patent medicine dealers thing came up. And they're supposed to just deal OTC, but you know, pharmacy business, in quotes, is lucrative. So everybody wants to go into it. Everybody wants to make money out of it.
And they're making a joke, like also like a joke out of it, that they now have other sides of the in their stores. They have a provision store.
Yeah.
I don't have an issue if in your pharmacy you have cosmetics, because that's part of our field.
Okay.
Because most of these cosmetics to drugs, in quotes, chemicals, things that fine.
True.
That's not. But in the case whereby you just set up, or if I worked in the hospital, I can set up. The issue of that drug resistance, and it's so bad. Let's say for now, you used the antibiotics indiscriminately, and the organisms in your body are resistant to that organism, to that antibiotic now. I come in contact with you. Maybe you have something contagious. I come in contact with you. I'm naive. We use that word. I'm a naive entity. I've not been in contact with that organism. You got. have not been infected with that strain of that organism. So I come in contact with you. You have used countless antibiotics in your lifetime. You've used so you have become like a walking organism cupboard, like resistant is just in you. So, and then I come in contact, I get it from you, and I say, oh, this is the first time. Maybe I go to the hospital, I'm like, this is the first time. Because it's not every time you go to the hospital that they carry out tests. The doctor can say, oh, based on evidence-based practice, okay, this symptom, this and this. Could mean this, and say, oh, use this. But I had gotten the resistant strain from you.
Wow.
That drug would not work for me. So you see, well, the issue of self-medication affects us, not just you that self-medicate. It goes round, it goes round. If I also give that organism to someone else or pass it on, like that. So everything.
Vicious cycle.
Yeah. So in the long run, we are killing ourselves because it to get to a point in time. Every day they develop they discover organisms that are resistant to most of the antibiotics we have now. So if the issue of self-medication is not curbed, or you see where we are heading to, it won't be the era of like before antibiotics, before the penicillins came. It's now going to be, because when the penicillins came, the organisms had not known the antibiotics. But now we're going to an era whereby the organisms would know those antibiotics.
Like, oh yeah,
and they'll be like, oh, I know it. So like that, so it wouldn't be effective anymore. So that's the era we are slowly. In fact, it's not slow anymore. It's fast because people go, and drugs. Like I tell my friends, please do not mess with drugs. You can do other things, but drugs. You have many drugs of abuse that because people take them self-medication over the counter, you can get them, or you don't. It's not the pharmacists like that owns the place. You can just get, because some patent medicine sellers sell some like prescription medications. So they get them, or people that have no idea about drugs too. They just want to go into the business of drug selling. So and they get all this. So you see how it goes on and on and on.
True.
Affecting everybody.
Okay, so our time is really fast spent.
I want to ask one question, because this is actually from experience.
Okay.
Now, there was a time I needed to get a drug for chest pain.
Okay.
And then there was a prescription given from the hospital, from doctor. Okay. And I got to the pharmacy and tendered my prescription. And they told me it's 2,500, and I had 1,000 naira with me. So I told the man that, okay, I can't afford 2,500. I said, okay, you know what? I have something cheaper that would still cure
the chest pain.
The chest pain and would suppress the pain. I'm like, okay, let me see. Just realized that even the name looks so similar. Yes. Oh, okay. And no, the name itself is the same thing. Maybe one or two letters were out. So
okay.
But was that right? The thing is, I used it and it worked.
Wow.
So how would you explain that scenario? Because, you know, for me, I should have said, okay, fake drug, don't let me try it, or something like that. But then I did, and it actually worked.
Okay.
Like I said before, the pharmacists are the drug custodians. So we know the substitute for this, and it might not even have been a substitute, because some prescriptions come with brand names.
Okay.
You get? Some prescriptions might come in brand names. So in a case, and there are some brands that are expensive more than some other brands. So in a case whereby, let's say, I would not want to give you examples, but the doctor writes an expensive brand, probably because that's what the doctor is used to, that's what the doctor has used over time and is confident in that particular brand. And then you come into the pharmacy and you do not have that amount.
Okay.
There are other brands, same drug, chemical equivalence. You have the same, let's take for instance, amoxicillin clavulanic acid. In this, you also have in this brand. So it will still do the same work.
Okay, so the pharmacist can be in the position to actually...
Because we are also there to help you economic, cost-effective treatment.
Okay.
I'm enjoying this conversation.
So I don't want you to break the bank.
Time is gone. But thank you so much, Ifeloluwa, for enlightening us on the fact that self-medication is bad. And in a way, we are truly killing ourselves. We are. So
It's a
please,
round
viewers out there, please do not engage in self-medication. See your doctor and, talk with your doctor, and then you get proper prescriptions to use for whatever and whichever ailments that you have. It's been an amazing time here on Tea or Coffee on our Wellness Wednesday. Yes. My name remains Modupe Jacobs.
I'm Oluwaseun Olusegun.
And I am Bura Olapupola.
Join us same time, same station tomorrow for another exciting edition. Bye.
Bye.
Bye.